Clicker. All right. Good. Good afternoon. I'm Allison Arwady, Commissioner at the Chicago Department of Public Health, and we are here to give an update on all things related to COVID in Chicago. So first, to start off, our travel order update. As a reminder, we update the travel order every 2 weeks at this point, and we have seen a number of changes here. As a reminder, the states in orange on our travel order require, if you are traveling from one of these states to Chicago or back to Chicago, you need pre-arrival negative test results, or you need to quarantine for 10 days. If people are fully vaccinated, 2 weeks post your second vaccine dose, or past your 1 dose if you get Johnson & Johnson vaccine, you do not need to abide by that quarantine. And then in the yellow, we still are recommending against non-essential travel, given risk of spread and variants, but there is no requirement for pre-arrival testing and no requirement for post-arrival quarantine. The major changes here, we've seen a number of states move in the wrong direction, from yellow into orange, and that includes Idaho, Montana, Minnesota, West Virginia, Maryland, Maine, and importantly, Michigan, in terms of the state that is near us and where we're seeing some more concern. We've also seen a number of states improve and move from that orange into the yellow tier. That includes Utah, Arizona, Texas, Nebraska, Kentucky, and the District of Columbia. Let's talk a little bit more about Michigan. This is what Michigan's case rate looks like right now, and we'll post these slides online for people who are not able to see them. We've seen in the state of Michigan case rates now looking like they were around Christmas in late December. Just in the last 14 days, a 112% increase in cases, and importantly, a 52% increase in hospitalizations. One of the questions we get a lot is, should we be concerned about an increase in cases if they're all in younger people and all of the people who are at more risk for severe outcomes or hospitalizations, don't end up getting infected? And theoretically, you could imagine that. But what we're seeing in Michigan, unfortunately, is that even if there are more cases in younger people, we still are seeing that translate into an increase in hospitalizations. Michigan is now third highest in the country in terms of new COVID cases, and it's surprising because they had been for months one of the best states in terms of COVID control across the whole Midwest. I will also note they have detected quite a lot of cases of that B.1.1.7 variant, the one that originally emerged in the UK. They have good surveillance in place, good testing for it, but regardless, there are concerns that some more variant in Michigan is driving some more, potentially, of the cases there. So let's talk about what we're seeing here in Chicago. So unfortunately, we have seen movement in the wrong direction on the 4 key metrics that we follow for reopening. So let's talk about them one by one. First, our COVID cases per day. That's really the biggest number that I have concern about, because that is how much COVID is circulating in Chicago. And when people are gathering or getting together or taking off masks, as that number goes up, the chance for spread goes higher. And you might recall that we'd been sitting just under 300 cases for a few weeks here, 270, 280. Unfortunately, we are now up to a point where we're seeing 350 cases per day. We really want to get under 200 cases per day to take us back to that lower risk state. Moving over 400 cases per day would move us to high risk. But the other way that we move to high risk is, you'll note that any metric reverts to high risk if we have more than 5 days in a row where we see an increase of more than 10% over the previous week. And so the absolute number here is only at 350, but the increase that we've been seeing has pushed us into high risk category because of that increase. We'll be keeping a close eye on that. As soon as we can not be seeing that kind of increase, we would hopefully be able to move back down to a moderate risk. The other thing we're seeing on test positivity, we're at 3.2% test positivity. Again, that's good. That's in the lower risk territory. But we were 2.7% positivity, a half 0.5% better than this in the last couple of weeks, and that's been a significant increase there. Our emergency department visits for COVID-like illness, this is our fastest way to really assess for the possibility of some COVID surge. Those have also moved in the last week from the lower risk back into the moderate risk, and really reflecting more people across the city sick enough to be coming into emergency departments. The good news is that our ICU numbers continue to improve. As a reminder, those tend to lag. We first see people having cases, and then we see people coming into the emergency department, and then we may see hospitalizations, and then we may see ICU and death. But our ICU numbers continue to look good. And if we look in a little more detail, here's what our case rate graph looks like. It's a problem here. We are up 30% in cases just in the past 14 days and up 23% in the last week. So we're not talking about the greater than 100% that they've seen in Michigan, but nevertheless, right now, not heading the right way. And what is driving this? So the biggest thing driving this is increases in cases in our younger adults. And I want to highlight that unfortunately, these sorts of increases are just what we were seeing in October. As we were starting to see the beginnings of what became our huge surge, it was really these same case rates in younger adults that started this. I am feeling more optimistic that we will hopefully be able to avoid a major surge because if you look on this graph, and all of this data is available publicly on our website, at the bottom there in the gray and the pink, those are our people in our 70s and our 80s, and we are seeing case rates broadly stay down in that group. We have just over 50% now of our folks over 65 have gotten at least a first dose of vaccine, which is good, but not good enough. Continuing to get vaccine into our oldest Chicagoans is critical, but this rise in younger adults is the main thing driving it. 18 to 29-year-olds first, followed by 30 to 39, followed by 40 to 49. If we look in the last month, you'll see the most cases by far. We've had more than 2,200 cases of COVID just here in Chicago among 18 to 29-year-olds compared to fewer than 200 cases in those over 80. But I do want to reiterate that where we look at deaths, we've had 1 death in the last month in people in the 18 to 29-year-old group and nearly 50 in those over 80 plus. And so again, for those who are younger, where we're seeing most cases, really critical that if you are taking some chances with COVID, please rethink that. Please wear your mask, and please be extra careful if you are interacting with anybody who's older or anybody with an underlying condition. We were averaging more than 88 new cases every day just here in Chicago among those aged 18 to 29, for example, and you can see that the numbers go down from there. The good news is that our case rates across race ethnicities are really looking about the same, really different than what we've seen throughout this whole COVID outbreak, where we saw very disproportionate numbers of deaths in Black Chicagoans and very disproportionately high rates of cases in Latinx Chicagoans. We now have seen those really equalize so that the number of cases that we're seeing every day, it really looks like Chicago. We have the highest rates currently among white Chicagoans, but where we have been seeing some increases over these last couple of weeks, it's been predominantly in white, followed by Black non-Latinx Chicagoans. But I want to emphasize that this difference is not big. It's really the age difference that is the driving most of this. Where we look at our hotspot analysis, and as a reminder, our hotspot analysis is only in comparison to Chicago. So where areas are red on this map, it is not that they are red in terms of major outbreaks. It's that where we look at how many people live in these areas compared to how many cases of COVID we're seeing. The areas in red, we are seeing more COVID cases than we would expect, and the areas in blue, we are seeing fewer than we would expect based on population. We've been following this week after week. But you can see this is also looking a little different than what we've been seeing in the past, but it is also looking somewhat similar to what we'd seen in October, with some real resurgence of cases, particularly around the Loop and the near North Side, and a lot of younger Chicago residents who live in those areas, seeing many more cases in that group. We continue to certainly see more cases in the Southwest Side, but amazing progress there in terms of driving back COVID. And then even on the Northwest side, a lot of the areas that had been our primary focus, 60639, have had a lot of improvement. And we're seeing some more in the further Northwest. And for me, this really is reiterating that vaccine is not the whole story here. We're seeing COVID variants spread in Chicago, and we are not testing every person who gets COVID for those variants, but we absolutely are seeing again that B117 variant that first emerged in the UK, that they're seeing a lot of in Michigan. We are also seeing more cases of it here in Chicago, and we have seen some spread. And so reminding people, we're seeing cases from across the city. It doesn't matter where you live in Chicago. We continue to see cases emerging from every portion of Chicago. We continue to see people being hospitalized, if we look over the last month, from every area of Chicago. Our emergency department visits, like I said, are up 45% in the past 14 days, have moved from the lower risk to the moderate risk state. And then our ICU occupancy is the lowest since the beginning of the pandemic. So that's good news. We have the fewest number of people seriously ill, the fewest number of people on ventilators, but that is coming out of the prior surge. And the concern is, with some of this increase in cases, are we going to see similar increases related to hospitalizations? Finally, where are we on vaccine? We have done more than 1 million COVID-19 vaccines now administered by Chicago providers. Really a great milestone. I continue to be very, very pleased with how our vaccine rollout is going. We continue to push out 98% of the vaccine that we're getting. We've got 94, 95% of it in arms within a week, far outpacing most states on those efficiency metrics. And in terms of our metrics related to equity, that is also going well. As you know, we set a goal, given that COVID has hit Black and Latinx communities harder, that the majority of vaccine every week would be going to Black and Latinx Chicagoans, since Chicago is 59% Black and Latinx. And again, last week, 53% of our doses went to Black and Latinx Chicagoans. 1 in 5 Chicagoans overall have now gotten a first dose of vaccine, 22.6%. 1 in 4 Chicagoans, if we limit it to those over the age of 18, and 1 in 2 Chicagoans over the age of 65. But I do want to reiterate this fully vaccinated number. Fully vaccinated means 2 weeks, technically, post that second dose. We only really track when people have gotten both doses. And where we look at across Chicago, we're at less than 15%, even among adults, that have gotten both of those doses. And so we are not at a fully vaccinated state yet. And so as you are being happy about the spring, and as you are going out, and as you are recognizing that we have made amazing progress here in Chicago, we need people to keep their guard up against COVID. I remain very optimistic that later in the spring, by the summer, we're going to be in good shape from COVID, as long as we continue to see a good rollout of vaccines and good vaccine uptake. We estimate that with the rate that we're vaccinating here in Chicago, somewhere in the late April to early May range, depending on how much vaccine we're receiving, about half of Chicagoans will probably have gotten that first dose of vaccine. But don't forget, where we're talking about Moderna, that's at least a month later, it's a second dose, it's 6 weeks later than that. So I'm not really anticipating us being at a very highly vaccinated state until quite a bit later into the spring, really moving into the early summer. And so please keep doing the things that you know work. I know, for example, with March Madness coming, people are excited about Loyola. I'm excited about Loyola. Let me remind you, Sister Jean is in the stands, fully vaccinated, 2 weeks post, and wearing a mask. Some of that good COVID behavior is perhaps what is driving Loyola's success, and please remember that if you are celebrating March Madness. Small groups. If you're gathering, gather with people who are fully vaccinated, ideally. If there's anybody who is at high risk, you should not be gathering at this time. And once people are fully vaccinated, 2 weeks post that second dose, that's when it is safer to be gathering without masks. But very few of us are really at that point now. The last thing I'll note is that we are continuing to see clusters and outbreaks in Chicago. And a lot of those are in younger Chicagoans, no surprise. We've had, just in the last few weeks, 7 different sports-related clusters and outbreaks that CDPH has been investigating. They've ranged from 4 up to 17 cases. They've been in high school sports, college sports, and adult recreational leagues. We've had 2 football outbreaks, 2 basketball outbreaks, a swimming outbreak, a hockey outbreak, a softball outbreak. This is not about the sport. This is about the fact that people are getting their lives back, which we love, but needing to keep those masks, not, where you're thinking about swimming, that's not during the swimming sport. That's about the gathering that's probably happening in informal ways around some of those events. And just reminding people that we continue to see outbreaks, and we do continue to see real clusters and outbreaks, particularly in related to some of the younger social events. So university social events, we're seeing real outbreaks there. We're investigating, we're doing the work that needs to be done. But please, as we're looking ahead here, 1C is when, on Monday, we're going to be opening up broadly to people with underlying conditions and the frontline essential workers here. Some of the very few people who won't be able to get vaccinated just yet would be healthy young college students, and that is really related to your risk for underlying conditions and for having severe COVID outcomes. But we are seeing a lot of COVID cases being driven by the decisions you're making. So please stay smart, stay safe, and keep doing the things that have gotten us this far. And with that, I'll turn it over to Dr. Geraldine Luna, Medical Director at the Chicago Department of Public Health, to provide some comments in Spanish, and then I'll come up and take questions.
Thank you, Commissioner. Y buenas tardes a todos. Yo soy la doctora Geraldine Luna. Soy la directora médica del Departamento de Salud de Chicago y tengo unas noticias que quiero compartir. Primero que nada, estamos en un tono un poquito no tan contentos, estamos un poquito más sobrio porque nuestros casos han empezado otra vez a subir. La seropositividad ha aumentado otra vez. Y yendo ahora a las órdenes de viajero de emergencia, a partir del 26 de marzo, Idaho, Montana, Minnesota, Michigan, West Virginia, Maryland, Maine han pasado al nivel amarillo, del nivel amarillo al naranja. Utah, Arizona, Texas, Nebraska, el Distrito de Columbia y Kentucky, al contrario, han pasado del nivel naranja al amarillo. Así que si está pensando viajar, que no deberíamos, estamos ahora en un momento donde deberíamos otra vez redoblar nuestras preventivas, pero si han pensado viajar, tengan eso en consideración, moverse de un área de menos carga viral a un área de más carga viral y el potencial riesgo que lleva a hacer esos cambios. De los 23 estados amarillos y territorios, lo que se requiere a la llegada de aquí, cuando llegan aquí a Chicago, no se les van a pedir pruebas de cuarentena o alguna prueba previas a la llegada, pero sí se les va a pedir que mantengan un estricto enmascaramiento, distanciamiento social y eviten las reuniones con personas, con más de una persona, especialmente cuando estamos hablando de personas no vacunadas. Y hay que abundar un poquito más en eso. De los 26 estados naranjas, lo que se les requiere cuando entren a Chicago es una cuarentena de 10 días o una prueba negativa previa a la llegada de no más de 72 horas del aterrizaje aquí o llegar en carro también a Chicago, con enmascaramiento estricto, distanciamiento social y evitar otra vez las reuniones en grupos. Si está completamente vacunado, y volvemos a reiterar lo que significa estar completamente vacunado, es que haya completado las 2 series de las vacunas, si son Pfizer o Moderna, o que haya tomado la única dosis, si estamos hablando de Johnson & Johnson, y hayan pasado 14 días después de esa vacunación. Eso es lo que se define completamente vacunado. Si está completamente vacunado, no tiene que hacer ni las cuarentena, ni presentar pruebas negativas 72 horas antes de llegar a Chicago. Y ahora, cuando estamos hablando general, de noticias general, hay una nota muy positiva. Ya hemos pasado el 1,000,000 de vacunas dadas aquí, administradas en Chicago. Para ser precisa, 1,080,000 dosis ya se han dado. Y entonces eso es una razón para celebrar, eso es un logro que ha tomado aproximadamente 3 meses después que las vacunas empezaron a darse en nuestra ciudad. La tasa de casos de Chicago, como les había mencionado, lamentablemente ha aumentado en las últimas semanas. Este es un momento para redoblar lo que sabemos que funciona. No podemos perder la perspectiva de usar una mascarilla que cubra nariz y boca, distanciamiento social de más de 6 pies de distancia de una persona y otra, lavarse las manos y quedarse en casa, si puede, a menos que tenga que salir para alguna urgencia esencial. Se recomienda encarecidamente a los residentes de Chicago que cancelen viajes, especialmente ahora que estamos viendo que se mueven de áreas amarillas a áreas naranjas. No es recomendable, y mucho menos áreas rojas. Lamentamos informar que Michigan, nuestros hermanos en Michigan, ahora ocupan el 3er rango en riesgo mayor de carga viral, seropositividad y alto riesgo de contagiarse con el COVID y presentar alguno de sus síntomas. Esto se ha visto que ahora presentan una variante, la B11, que es del Reino Unido. Así que tengamos en cuenta que tenemos una cepa que es mucho más transmisible. Tenemos que redoblar otra vez las preventivas. Y entonces, moviéndonos a decir que los casos que hemos visto aquí en Chicago se relacionan a brotes con nuestros jóvenes en los deportes. Sabemos que el clima está mejorando, pero de la misma vez empezamos a ver que nuestros jóvenes se reúnen en grupos, y ahora hemos visto los brotes en todos los tipos de deportes. Y las variantes que hemos visto en estos jóvenes es de la B117. Positivo es que, bueno, ya los latinos no ocupamos ese primer lugar, se ven más bien en los anglosajones, lo estamos viendo en el Loop y en el área norte de la ciudad. Les recomendamos que sigamos las preventivas otra vez. Tenemos que bajar, no queremos entrar en una tercera ola del COVID-19. Y entonces, en una onda positiva, el equipo, el chaplain de Loyola, la hermana Jean, tiene 101 años, y ahora la podemos ver vacunada, la podemos ver usando mascarilla, y ese es un tono importante y un mensaje muy poderoso a nuestros jóvenes que ahora quieren estar más activos, ya viene la vacuna, y vemos esas tendencias. No olvidemos, las preventivas funcionan, no podemos bajar la guardia ahora. Es el mejor momento para echar para atrás y evitar más contagios, más muertes relacionadas al COVID-19. Gracias.
I've got some questions here. I'm going to do the pool thing, and then we'll get to the people in the room. First, from the Tribune, you kind of addressed this, but what's driving the increase in cases, and is there, more specifically, is there evidence that indoor dining or school reopening factored into it? And if that isn't a factor, how do you know that?
So clearly, this is multifactorial, where we are seeing major increases like this. Like I noted, where we've seen significant outbreaks, it's been around socializing. And some of that socializing may be taking place at bars or restaurants, but where we're seeing the connections, it tends to be more among university groups, people who are knowing each other and then are gathering in given spaces. We've not seen concerns related to school reopening here or anywhere. You'll note that the child rates remain very low. And schools, nothing has changed there related to schools being a sign of spread. Certainly, we're doing a lot of testing with Chicago Public Schools Open. We're testing people who are asymptomatic, not seeing anything unexpected related to, related to case rates.
A question related to the United Center, also from the Tribune. When do you anticipate the United Center will begin to do 6,000 appointments per day? And also, will there be changes in United Center eligibility once we reach 1C? And how will that work?
Okay. So a couple things on this. So first of all, we continue having to swat down rumors that something has changed related to eligibility at the United Center. Nothing has changed related to eligibility at the United Center. I know there were things, again, circulating on social media saying you should take this code and you should use it because the city wants anybody to sign up. That is not true. We've been doing well over 5,000 doses a day at the United Center every single day. The reason we haven't done that full 6,000 is because we've been holding vaccine to be able to start the drive-through, which actually started today. And so as of today, we started, the plan for today is to do 500 cars. It is the first time we have done a drive-through operation here in Chicago. There will probably be some learnings there. And the plan is to really up that drive-through up over the next few days to about 1,000 cars is the current plan. So we absolutely will use, trust me, every dose of the vaccine that has come there, but wanted to have a combination of walk through and drive in. We are having no problem filling appointments. So let me just reiterate, and thank you for putting these numbers on the screen as a reminder. For anyone who lives anywhere in the city of Chicago, ZocDoc.com/vaccine remains the place where you should go to find medical appointments for a COVID vaccine. The other place to check is with your healthcare provider. So every day we do put some appointments online open to anybody in Chicago at the United Center. It's a limited number because it's mostly if there are vaccine appointments that have not been filled, et cetera. Those go instantly. We know there's a lot of demand there. But please, if you do not live in one of the prioritized zip codes, if you are not one of the groups, we've been working with some of the groups that serve people with disabilities or groups that otherwise need to be prioritized. There are separate sign-up efforts that are happening for that. There are codes related to that. And let me just be really clear that if you try to sign up and attest that you live in a certain zip code or are supposed to be on a list and you're not, we won't confirm that appointment and you won't be able to get a vaccine. So reminder, top priority at the United Center, people 65 and older. You can live anywhere in the city of Chicago. We are holding appointments for people who are over 65, and you can call that phone number, 312-746-4835. We've got more than 200 people who are standing by, helping make appointments with a priority on seniors, but nothing has changed there related to eligibility. When we move into phase 1C on Monday, eligibility across all of the city will open up for everybody who is open in 1C. So that would mean everybody with the underlying conditions and all of the frontline essential workers that we've previously detailed and that you can find on chi.gov/covidvax. So, for example, if you are able to get an appointment through ZocDoc, you would certify that this is how I qualify in a 1C kind of way. Most of the appointments in this first stage at United Center are booked already, to be clear. We're going to need to be doing a lot of second doses related to Pfizer, but the appointments related to drive-through are going to continue. There's work behind the scenes. Again, we have to make sure that Cook County residents are able to get the supply that's been set aside for them at the United Center. More of them are likely to use drive-through. But please rest assured, the United Center is a small piece of the vaccinating that we're doing in Chicago. It's a small piece related to the vaccinating that we're doing across the state. Nothing has changed. If you don't live in a prioritized zip code, ZocDoc.com/vaccine is where you should continue to go looking for appointments, and that is not going to change as we move into 1C.
The tribe is asking a more general overall question about phases and what we're in. And I'm combining some of these questions because there's so many and I want to get to people in the room. But, asking, for instance, would a newly eligible Chicago resident be able to get a vaccine at sites outside of Cook County if they aren't eligible here? Does 1C even exist anymore? How does it, does it, with the state providing guidance and just general kind of confusion?
Yeah, absolutely. So, let me take a step back. Here in Chicago, we have never changed anything related to eligibility or timelines. We are doing what the CDC recommends. 1A, healthcare workers and people who lived in congregate settings. 1B, people over 65 and the prioritized frontline essential workers. 1C, people with underlying conditions, and the other essential workers. We've not switched a single thing about that timeline. We had actually estimated that March 29th would be when we would move to 1C way back in December when we set out our time frame. So 1A, 1B, 1C continue to exist and have not changed one bit here in Chicago. The two changes I think that have come is that the state appropriately recognized that there are some settings, for example, downstate, where they were having trouble, filling vaccine appointments. We want to make sure vaccine appointments appointments are always being filled. And so the state set out this 1B+, which was just focused on people who had underlying conditions, not the essential worker part. And so in the same way that the state laid out 1B+, we said, that's fine. If you are unable to fill appointments right now in 1B, if you don't have people over 65, that can go to people in 1B+. We've made that available at the United Center. We've made that available to our providers. And we've said if you have existing patients and you don't have people over 65, last week and this week, they've started vaccinating those with underlying conditions. But we are moving to 1C exactly on schedule. And the other difference will be that President Biden announced that he wants all Americans to be eligible for vaccine by May 1st. And that would be our phase 2 or our stage 2 where everybody is eligible. And I'm hopeful that we'll have enough vaccine to be able to do that. I expect that we will. And so we had initially laid out March 29th as the expectation for 1C and May 29th for the expectation for phase 2. I think that probably that May 29th will move up to May 1st, possibly even earlier, but it's all going to depend on vaccine supply. So I know it's been hard for folks where there've been a lot of different directions and prioritizations. We have tried to be as consistent as we can, and I want folks in Chicago to hear that starting Monday, most Chicagoans are eligible for a vaccine. We estimate around 84% of adult Chicagoans are eligible for a vaccine. And there's not going to be enough vaccine right at the beginning, but you're going to be able to get a vaccine. I would anticipate in April and May as vaccine rolls up. And you should keep going to ZocDoc.com/vaccine, and you should keep checking with your healthcare provider. They're going to be prioritizing people with underlying conditions. We're going to be doing additional work to bring vaccine to essential workers, just as we've been doing all along.
There's several questions related to Loretto Hospital and an update on that. What's the status of the investigation? When did the city stop sending them doses? And has the city found other examples of providers going outside the guidance?
Okay, so lots of questions in there. I don't really have a lot more to say about Loretto beyond what I've already said. Obviously, we were very disappointed in some of the decisions Loretto Hospital was making. Number one, they completely went against guidance and gave vaccine to people who were not yet eligible in Chicago. And secondly, they were making it so that well-connected individuals could jump the line and were not focused on the really needy parts of Chicago that they serve. And so in that context, we stopped providing first doses of vaccine. We allocate vaccine on a weekly basis. We did not provide any first doses of vaccine this week, and they won't be receiving any first doses of vaccine until everything is complete here, until we're sure that all their reporting is completely up to date, until we're sure that their plans are to vaccinate their own patients and their own community, which of course is the goal of every hospital in Chicago. We have been in communication with the board there about that, and really, you know, it's a sad situation. It is a small amount of vaccine in comparison to the more than 1 million that have been done, but it is just not what we're going to tolerate here. And so I don't really have much more to say about that, except that they won't be getting more vaccine until everything is resolved there.
Just follow up on that, though,
yeah.
From here, because if we just follow up on that, because LaShawn Ford, the state representative who's on that board, resigned today, and one of the reasons he resigned, he said, is because in protest of how those who are in charge of those vaccines have been reprimanded at this point. Do you think the signal has been strong enough in terms of how the city is responding here to let those officials know that what they did was wrong, and that has to be a broader signal for Chicago? What is your take on how it's been handled?
Yeah, so I want to just clarify. The Chicago Department of Public Health does not in any way regulate hospitals or the staffing of hospitals or personnel matters at hospitals. What we control is vaccine supply. And with vaccine supply as precious as it is right now, we know that restricting vaccine access is major punishment for any facility that is not doing what they are required to do. It was hard decision initially to say we're going to pull the provider on the west side that is an anchor provider for that community that we knew had done a lot of vaccinating. But once it was clear that they were vaccinating people who were not eligible, we have no choice but to cut that vaccine. So I'm really not going to comment about the personnel matters. My priority is getting Chicago vaccinated and making sure that if we have providers who are not performing in ways that meet our efficiency, equity, and general goals around vaccination, they won't be vaccine providers for us right now. And I want to really keep the focus on making sure that we get vaccine to the parts of the city that need it most, and that's really where our priority is and where it's going to remain.
I had Loretto follow-ups too. There was questions about the Austin neighborhood, and you started to answer, but if you could talk a little bit more about what the city is doing to make sure that community, hard-hit community, is not being ignored now, and what's covering for this.
Yeah, absolutely. So, Austin already was a neighborhood that was lagging in terms of vaccination rates. Clearly, Austin is in our Protect Chicago Plus initiative, meaning there's been vaccine directed only for residents of that community. We are bringing in another healthcare provider to make sure that those Protect Chicago Plus initiatives continue, are uninterrupted, are serving only Austin residents. We're also working with some of the other providers who serve that area. We've made Austin obviously a priority for appointments at the United Center, so people can call that same phone number if they live in Austin and want to get an appointment. We'd love to be able to serve them there. And you're going to be hearing some more in the weeks to come about some other things that we'll be doing in that neighborhood. It was already a focus for us because of Protect Chicago Plus. The good news is we have a lot of providers who are really willing to help cover some of that, and we're planning in a way that will continue to direct vaccine to Austin.
WBEZ has a question. Advocate Aurora says they're now vaccinating people age 55 and up. Is this within the guidelines, and are other hospitals taking a similar approach?
So the recommendation, of course, right now in Chicago is that if you cannot identify somebody who is over the age of 65, that you should be doing your existing patients with the highest risk conditions. It's possible Advocate Aurora has a lot of patients and said, let's start with those 50, 55 plus who have underlying conditions. That would be appropriate. But in terms of public availability, when people are using ZocDoc.com, for example, to sign up, we will not be using an age-based strategy. We will be using the strategy that opens in 1C to everybody with underlying conditions and to everybody with who are in those essential worker groups. So if a hospital is using some of that decision making to prioritize its own existing patients, that's fine and not a problem.
They had a question related to herd immunity. Is 70% still the number, or is it higher? And considering less than 50% of people get flu shots annually, won't that be difficult to reach?
Yeah, it's interesting. I feel like people got very, very interested in this 70% herd immunity number early on, and it's never been that straightforward. Our goal is to get to a point where COVID is controlled. I didn't say eliminated. I don't think we're going to eliminate COVID. But we actually defined in our metrics what it means to be controlled from COVID. And if we can get down to the setting where COVID is controlled, we're going to do that through vaccination. We'll see what that looks like across different settings. I feel like 70% is a pretty good guess in terms of what that may look like. But if we are pairing good vaccination efforts with really good masking and social distancing, we may actually come under better control. And so I don't think there's going to be a magic number that really says now we've hit herd immunity. It's going to be about being able to have disease controlled here in Chicago and across the country, and we'll see what that number looks like. That was an estimate based on other prior infectious diseases.
CBS 2 is asking, there are areas in the city with low rates of vaccination that are not in the Protect Chicago Plus program. As the effort brings the initial 15 areas up to speed, do you foresee adding any other neighborhoods that might need vaccine support?
Yeah, so just as a quick reminder, those Protect Chicago Plus communities were identified using the Chicago COVID Vulnerability Index, which we looked at risk factors that would probably suggest less access to vaccine in Chicago and higher risk of COVID. And so we ranked all 77 community areas. That was based on what COVID looked like through the end of December, as well as underlying things like where did we see a lot neighborhoods that had a lot of crowded housing, had a lot of essential workers, had a lot of people with underlying conditions, had low levels of health insurance, had low levels of primary care, et cetera. And really, this Protect Chicago Plus was designed to be our 1B focus. So over 1B, over the 2 months that we've been in 1B, we have been rolling out community by community across these 15 communities. As we move ahead into 1C, we certainly will maintain focus on there, but we'll be pulling in where have we seen data related to lower vaccination rates. The good news is that the Protect Chicago Plus initiatives and some of the other things that we've done with essential workers and prioritizing vaccine and Protect Chicago has really worked. Like, we've seen the case rates very much improve where we've been able to do this focused vaccination work. And we've seen major improvements. Like, we can see week by week the decisions that we make on the policy level show up in the data. So as we move into 1C and eligibility opens much more widely, you're going to be hearing more about new and creative things that we'll be doing to bring vaccine to under-vaccinated communities. So the Protect Chicago initiative, in terms of focusing on data and saying where do we most need to go, will absolutely continue and be a major focus for us, not just in 1C, but from here on out, like as we continue our vaccination efforts over the course of the year.
Doctor, we talk a lot about first doses. Are there things we should know about the second doses? Are you seeing people go to get their second doses at the rate you'd hoped for? Are there myths you'd like to dispel with regard to that second dose?
Yeah, great question. So we do follow this really closely. We have approximately 94 to 95% of Chicagoans at this point who are returning for their second dose broadly on time. And we have done some analysis of that. I think those numbers are good overall. And one thing is we've looked across settings, and pharmacies are actually the setting that we've seen people least likely to come back for that second dose. And so we are working with our pharmacies to make sure that they are making that second dose appointment, that if they're doing some practices, we really want every provider to have a plan near the end of the day to make sure that they are calling in people who are already eligible. If that wasn't what they are doing and they're vaccinating other people, they've got to make sure those people get a second dose of vaccine. So we've seen by far the least showing up for the second doses in the pharmacy settings, and we've seen very much better and really consistent across all of our other settings, with hospitals and City of Chicago really leading the way in terms of the best return for second doses. I think we've also looked at this by age and by race ethnicity. We are seeing younger Chicagoans a little bit less likely to come back for their second vaccine, and I would just reiterate that you've got to get both doses. If you got Pfizer or Moderna, you're only about 50% protected after that first dose, and it goes up to the 94, 95% protected. At least this is what we saw in the trials 2 weeks after the second dose. So we need folks to come back. And no major changes or surprises in terms of race ethnicity. We saw Latinx Chicagoans coming back the most often for second doses, but broadly not a lot of differences there. I think the one thing that stood out was just making sure that people through the pharmacies are getting it. That was the one note. But yeah, second doses are really critical here. If you get the Johnson & Johnson, you can get the one dose, but otherwise you need to get both of those doses, and you're only going to be considered protected 2 weeks after both doses of vaccine.
Hi, Dr. Arwady. Enrique Rodriguez from Univision Chicago. Can you talk to us about the risks involved for those who travel to low vaccination countries like Mexico, for example? And what are the requirements for adults who do so and are fully vaccinated once they get back to Chicago?
Okay, so two things there. I like that you ended with fully vaccinated. So my strongest piece of advice is please do not travel until you are fully vaccinated. 2 weeks post your second vaccine. And that is doubly true if you're planning to travel internationally, because the US has done by far the most vaccines of any country in the world. And especially where we look at more, middle or lower income countries, there are countries that are just now starting to vaccinate. And so even somebody who's vaccinated, we want, if you're out traveling, just like if you're out in Chicago here, you definitely need to be continuing to wear that mask and do the social distancing. In terms of requirements around sort of travel back, for example, if people are there, the city does not set anything related to international. That's really set at international levels. And generally, airlines and others, there's some requirement around testing there. But for the city, there would not be anything different related to travel. So please, though, bottom line is delay that travel, especially international travel, until you are fully vaccinated. Your risk goes down a lot. And then when you're in public spaces, if you're on the airplane, if you're in the airport, if you're, in another setting, anywhere where you don't know everybody around you has been fully vaccinated, please, 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 extra careful with this because we've been making really good progress here and we don't want to see it go backwards.
One more question. How safe is it for adults who are fully vaccinated to travel with their children who are not? Now the spring break is pretty much here.
Right. So, again, we're kind of in this in-between moment right now. The best thing that you can do to protect children is for all the adults around them to be vaccinated. And I think certainly the challenge here is that children are not going to be able to get a vaccine probably for a good number of months. I don't anticipate teenagers probably until very late in the summer or sometime in the fall. And I don't anticipate younger children probably until the very end of the year, maybe even early 2022. We'll see. The trials are just now going. And so if you are traveling and you're going to a setting where all the adults are vaccinated and none of the children are at high risk for severe outcomes, I would not have a major concern there. If you have a child who really has a risk for severe outcomes, we do want to continue to protect that child, and traveling would be of concern for them. But it's mostly about making sure adults are fully vaccinated to wait to travel, and then having everybody continue to do those things that matter. We sometimes think about, if you talked about children in the way like they were a vaccine trial, right? You know how we talk about COVID vaccines as being nearly 100% protective in the trials against hospitalization and death. Being a child is also nearly 100% protective against death. It's not 100%, but it's very, very protective against hospitalization and death. We've just not seen a lot of kids get hospitalized or die, thank goodness. But where there are kids with the serious underlying conditions, you can never sort of say that 100%. So as more and more adults get vaccinated, the risk for kids is going to continue to go down. And in this in-between space, have kids keep doing this. Please don't have a lot of gatherings with children who can't be vaccinated yet. Think about getting all the adults vaccinated before you're getting together, and then the children in that setting would be lower risk.
Doctor, if you could just talk a little bit more about what you meant by we are in this in-between moment. Mm-hmm. And in the context especially of some of the pictures we're seeing coming out of Florida, mm-hmm. where clearly people think this thing is over, yeah. and a lot of people from here are going to be going there as we speak. Talk to us about that and put us some context there.
Absolutely. So the reason I talk about this in-between moment is that, boy, it's such a moment of hope from a vaccine perspective. We're making great progress here in Chicago, across Illinois, across the U.S., and we know that that is what is ultimately going to get us past COVID. But I think people are so excited about the promise of vaccine, plus just the fact that there has been quite a lot of reopening and then many more signals for further reopening, that we're just jumping the gun a little bit. I am very optimistic, like I said, that by the summer, we're going to be in good shape here. I always have to put a little caveat on that in case there's the emergence of a new variant or some other major problem, but things are looking good when I think about what do we look like here in June and July and August and beyond. But in terms of what things look like in March and April, it is a real moment of question here, and where we see cases going up like this, even in the setting of a good vaccine rollout, it's too early for us to think COVID is over. And I know people are anxious to get out, but we don't have a lot of the city fully vaccinated yet, and the risks really remain high and growing from a COVID perspective. And
just sort of a nerdy math question, if I may. In terms of the case numbers,
yes.
you were talking raw numbers, and
yes.
we're pushing up towards 350, 400 is much higher. We don't want to go there. We were around 300. In terms of the rate, though, something that we're struggling with on television all the time to try to put context on it. Are we having less testing now because vaccinations are up?
Yeah.
And as a result, the the denominator in that equation is actually shrinking, and so it's a false number. Tell us about that. Explain that.
Yeah, that's a great question. I actually talked about it a little bit on Facebook this morning. So, for example, since last week, we saw a 23% increase in cases and a 6% increase in tests. So it's not just that you're testing more, it's that your cases are truly outpacing it. We're actually doing a good job of testing here in Chicago. We're testing about 12,000, even more on average per day. That's well above the minimum of what we should be doing from making sure we're doing enough from a surveillance perspective. And it's really been in line. We've seen it follow very closely what our case numbers look like. So as more people are having symptoms and having cases, a reminder, if you have symptoms of COVID, you need to stay home, you need to get tested. None of that has changed. And so this is not testing. We are testing more than we were last summer. And so if you look online, we actually did a little bit of a comparison that the slightly higher rate that we've been seeing over the summer, some of that is a little bit more testing, but in terms of absolute risk, it's really these numbers of cases. And so the reason we use that 400, again, we've used 200 and 400 from the very beginning here on purpose. Those are rounded numbers for Chicago's population that put that rate into perspective. So that 400 cases per day in Chicago is roughly equivalent to the 15 cases per 100,000 per day that our travel order is pegged to. That is roughly equivalent to the national case rates that are set for very high. And so, I think people don't think very well in rates. They think in terms of numbers, and that's why we've often translated it. But when we hit 400 cases per day, that would be us equivalent back on our own travel order, just to give a sense of like what that risk looks like. And that would also tie us to the national rates that have been set in a lot of settings for really high risk, and that's where the worry is.
Thanks, Doctor. Should the city think of this as the beginning of the third surge of COVID?
I certainly hope not. I am concerned, and I hope everybody is concerned when they look at this data, and we are seeing increases. Our epidemiologist did a lot of work looking at data here in Chicago, across the country, to see what predicted the second surge. And we track these 8 indicators, and the 4 that we highlight here are the ones that were shown to be particularly predictive. And so we have to take seriously not just the number, but that rate of increase like we did. And, moving from low to moderate, those are things that were predictive of some potential trouble. I don't know fully what's going to happen here. I do know that we are pushing vaccine absolutely as quickly as we can, ramping up our monitoring for the variants, which we are seeing and are seeing some spread of, and continuing to ask people to do, what has gotten us this far. If we see a big increase in cases not accompanied by an increase in hospitalization or death, I don't worry about that as much. But if we start to see it, impacting in serious ways, and then the big question is, what does this mean for reopening, even though you didn't ask it? And so we are, we're not at a, I was very hopeful that this week, we've been saying, as long as we can stay in this moderate low, we'll keep moving. We're not able to make additional movements on that today. I'm very hopeful that if next week things have stabilized again, even if they're at this relatively higher level, as long as they're flat, not seeing these major increases, we would again move towards reopening. And this in no way signals that I am concerned about a few months from now. I'm concerned about right now, March, April, kind of into May, while we're working to get more folks vaccinated.
I was going to say, last week you said we were in a race against time as far as vaccinating was concerned. I was wondering if you could say what the modeling for CDPH was saying about deaths.
Yeah, our modeling is still looking reasonable. I think there's just a lot of questions here. Michigan, for me, is a major concern. Knowing that that's been a state that has had good rates, yes.
Is it in Detroit? Where are they seeing it?
Some of it is around Detroit. Some of it is north of Detroit and Huron, and then they've got another pocket sort of in the northern area. You can look online if you're interested, but yeah, it's not just one outbreak. It's multiple settings across the state that they're seeing real surges, and especially because they're seeing hospitalizations too. And I know it's a state that's been handling COVID well, and so I think they have done a lot of variant detection there, and that remains just sort of a big question overall. But I think, getting folks vaccinated here and getting them to not think we're done first is the trick. And so that's why the main thing we're emphasizing.
Two more. There's the hotspot analysis that you put on the screen.
Yeah.
As far as my publication is concerned, there's a relative lack on the Mid-South side. Do you, the CDPH, have any idea why we're not seeing spread there as much as we are to be expected, I think is the way you put it?
Yeah. You know, we have often seen the South Side be a little bit more protected broadly. I think certainly the South Side got hit very hard very early on before we were doing as much testing, right? And we still, where we think about where we've seen the most severe outcomes in terms of hospitalizations and deaths, that has still been broadly across the whole outbreak among Black Chicagoans, many of whom live on the South Side. But so I think there is some, you know, perhaps there's some immunity there, but also I think some being careful. Like people who lived in families and communities that were hard hit have remained, I think, in many ways, cautious against COVID, and that's really the way we want to keep it. We've been working hard to get those communities vaccinated as well, but the bigger push has been recently in the Latinx communities, where we were so much seeing those very high case rates, and the fact that, you know, we are now seeing cases and outcomes look like Chicago is something I'm really proud of, and that we want to keep, we want to really hang on to and see that continue.
And the last thing you said was that, you know, when COVID is controlled, and I'm just wondering what you expect life to look like when we're all in those metrics on the right. Does that mean we're not going to have to wear masks anymore? No anxiety when we're going into pharmacies or the CTA, clubs open again, restaurants at full capacity? I mean, what's it going to...
Yeah, I think, you know, that's really projecting pretty far in the future, where we're kind of fully in this controlled, you know, sort of phase 5. What does this look like? But yes, I do think we're going to get our lives back. I think some of the things that will be different is that I hope people will actually stay home more when they're sick. I hope people will wear masks if they're sick, even if it's not COVID. We are still very much learning about the length of immunity after immunization. And so there's some studies there. There remain questions. You know, right now, to be very clear, there is no need for a booster dose. All of the 3 of the vaccines we're using here in Chicago are protective against the variants that we are aware of. But there remain some questions there about what's going to happen. And getting the rest of the world vaccinated is absolutely critical here, because it's not going to do us any good if variants continue to emerge. But, you know, I really am expecting by late in I'm not necessarily talking July here when everything is open yet. July, things are going to be much more open is my expectation. But by later in the year, if COVID is more, you know, if we think of it more like we think about the flu, frankly, right? Like this whole time we've been saying, don't think about it like the flu because it's so much more deadly because all of these other outcomes. But if we actually have very high vaccination rates, we vaccinate for flu to protect mostly against severe outcomes. If we're seeing, you know, some low-level people getting COVID in a way that does not spread significantly and does not put people at risk for severe outcomes, it's probably something we'll live with. And there may be further developments. We may still get a drug that is able to completely cure COVID, but we don't have that yet. And so vaccine remains by far the best hope. And, you know, on the one hand, it's frustrating when I don't have enough vaccine for everybody, but I'm also really happy that we're seeing so much demand for COVID vaccine here in Chicago. And that's what we got to keep up, because really soon here, when there's enough vaccine, it's going to be about having people who maybe didn't raise their hand first now wanting to get vaccinated and be able to more fully participate in life again.
Thanks. Thank you, everybody.
Thanks.